Hello everyone, I'm Dr. Srilakshmi KJ and I'm currently a junior resident at a tertiary care hospital and a research student at the California Institute of Research and Technology. Today, I'll be presenting a case report titled Sjögren-Larsson syndrome, an atypical presentation with developmental delay, guided by my mentor, Dr. Wakas Bani. Sjögren-Larsson syndrome is a rare inherited disorder passed down through families in an autosomal recessive pattern. Its main characteristics include spastic diplegia, paralysis, congenital ichthytic hyperkeratosis, and mild to moderate mental retardation. It occurs due to lack of activity of this microsomal enzyme called fatty aldehyde dehydrogenase. The complete absence of this enzyme is the primary cause of the syndrome, leading to the buildup of fatty aldehydes and alcohols within the body. Here, there is an inability to break down the fatty alcohol molecules, allowing for an increased accumulation of these molecules within the skin, nervous system, and in the eye. The initial manifestation of Sjögren-Larsson syndrome is in the form of development of congenital ichthyosidosis or the skin manifestation, which appears in the initial few months of life. Later on, the neurological symptoms tend to develop within the first 2 years of life and can present in the form of developmental delay, where the child finds it difficult or takes a longer time in learning how to crawl. The child can present with difficulty in speech, or in severe cases, the child can even have a severe impairment or in the IQ or a very low IQ. Sjögren-Larsson syndrome was first described by a Swedish physicians, Sjögren and Larsson, and it was initially reported in a group of 28 interrelated patients of the Västerbotten County, Sweden, who had presented with symptoms in the form of a clinical triad, which includes intellectual disabilities, muscle stiffness of the legs, such as spastic diplegia, and scaly skin from birth, which is the congenital ichthyosidosis. Going on to the proper clinical presentation, here we have a case of an 8-year-old male child which was conceived through a consanguineous marriage and brought to the hospital with complaints of developmental delay and skin disorders since birth. The child was born at term via C-section due to premature rupture of membranes. The child cried immediately with a mild voice. He had no unusual conditions at the time of birth except for an inability to fold the hands due to a skin condition which was later diagnosed to be congenital ichthyosidosis. Besides that, the child responded adequately to the light and moved his head towards the direction of the voice. He showed no abnormal presentations at the time of his birth. During his early days, care was only taken to keep the skin moist and to alleviate symptoms that arise due to ichthyosidosis by applying moisturizing creams such as Cetaphil, Aveeno, and Physiogel AI lotion. Going a bit into his developmental history, the child rolled over at the 7th month, skipped the stage of crawling. He was able to sit with support at the age of 1 and started standing without support at the age of 2 years. He expressed his requirements with the help of action and used to give physical directions by the age of 1 year. The child started using single words at the age of 2. Later on, a neurological exam conducted on the child revealed delay in development in reaching milestones and a mild intellectual disability. Later course of his development, the child also presented with spasticity. The spasticity or increased stiffness started in the lower limb and started to progress to the current condition. He had brisk deep tendon reflexes and increased tone in the lower limbs, and the upper limbs showed no abnormalities in tone as well as deep tendon reflexes. The child also showed evidence of mild aphasia. Going into his current presentation, he is able to walk now, but in a wobbly manner, and was diagnosed with gait imbalance. He has difficulty trying to stand up from a sitting position. The patient has been undergoing gait treatment and balance treatment since the past 2 years, and he has shown significant improvement. The child is now able to run with the help of an ankle foot orthotosis. He shows a tendency to walk on toes if he's not on the ankle foot orthotosis. He's now able to walk on his own if forced to do so as well. The child is able to identify the alphabets in English and the numbers and is also able to write them, but shows a mild signs of strain. Child finds it difficult to concentrate on study matters, but however, if the concepts are communicated in short intervals and during the play, he seems to find it easier to learn. The child has ability in identifying different colors and has the ability to identify and correlate with common household as well as day-to-day objects. To identify the further the delay in development and his symptoms, the parents were advised to perform an MRI. The MRI showed symmetric confluent T1 hypointense, T2 flare hyperintense white matter signal abnormalities in the periventricular and deep matters of the both cerebral hemisphere with relative sparing of the temporal and the occipital lobes. Cystic degeneration in the biparietal white matter was also seen. There's a relative sparing of the subcortical white matter, which is also visualized. A mild T2 hyperintense or T1 hypointense signal changes were suspected in the ventral pons. There's also a mild thinning of the posterior body or the isthmus of the corpus callosum. Currently, the child is given treatment for the ichthyosis in the form of skin moisturizers such as Cetaphil and Physio AI gel. Treatment for his speech delay is given in the form of speech and language therapy. The child is also receiving an occupational therapy to improve his fine motor skills. Currently, the child is on an ankle foot orthotosis, and he is also receiving gait as well as balance training of twice daily for the initial few months and later on to twice weekly. Going into the discussion part of the case report, it's important that we realize these findings are really difficult to pick up at an earlier stage. Such syndromes occur at a very low rate in the general population as well. So the parents are supposed to be advised during the initial counseling sessions to be careful and to keep a keen notice for symptoms that are out of the normal presentation. Any child presenting with a non-specific skin lesion are prompted towards going into a genetic and biochemical analysis. Early detection of these kind of developmental delays at an earlier stage of the development of the child can help in a better prognosis and later on improve the quality of life of the patient. Hence, parents should undergo a complete genetic workup and are advised to look for signs and symptoms earlier during the course of development. I hope that this case presentation was an insight to each and every one of you who had watched this presentation, and thank you so much.